Good afternoon, everyone. I'm Linda Benedict, Secretary of the Press Club, and it's my pleasure today to introduce our speaker. But first, I need to remind you to silence your cell phones and that only members of the Press Club and members of the media can ask questions of our speaker. Our speaker today is Jan Moller, Executive Director of the Louisiana Budget Project. Moller has spent more than 2 decades analyzing, reporting, and writing about public policy in Louisiana. Since 2011, he has served the Louisiana Budget Project as its Executive Director, where he leads a team of research, advocacy, outreach, and communication professionals. Moller and his team have in-depth knowledge of the state's budget and tax structure, healthcare policy, and the public safety net. Before joining the Louisiana Budget Project, Moller was an award-winning journalist in Washington, D.C., Las Vegas, and Louisiana, where he covered state government for the New Orleans Times-Picayune. Born in Sweden, Moller grew up in Pittsburgh and remains a devoted fan of the city's professional sports teams. A graduate of the American University, Jan lives with his wife and 2 children in Baton Rouge, where he enjoys coaching soccer and playing the occasional round of golf. Please welcome Jan Moller.
Well, thank you for having me. It's an honor to be back here and see friendly faces and new faces. I'm going to talk about kind of the fiscal situation and how we kind of are looking at this new administration. But I want to start with some news about the Louisiana Budget Project. And this isn't news to everybody in this room, but maybe to a lot of it will. We are changing our name. Starting, later this month, hopefully, the Louisiana Budget Project is going to become Invest in Louisiana. And the reason we're changing our name is quite simple and a little complicated, but I want to say, go back to when we started at the Louisiana Budget Project. Before I got here in 2006, we started as a project of the Louisiana Association of Nonprofit Organizations. Since 2013, we've been an independent, standalone organization, so we haven't been anybody's project for over a decade. And so it was time to change our name and do a rebrand like organizations sometimes do. And at first, I thought we were going to be an institute or a center or something think tanky. And then we went out and hired a consultant and we started really talking to stakeholders. And Invest in Louisiana is what we had called our policy conference, but it really is a through line to what we are about as an organization. What we are really talking about is how do you build an economy that works for everybody in Louisiana, and we think you do that by investing in people and in communities and giving people the tools that they need to be successful and to reach their full potential. So Invest in Louisiana really kind of spoke to our vision for how we can build a better state. And so we announced this at a conference last fall. It's taken a little longer than expected to get all the bells and whistles ironed out and building a new website. But we're going to have that up and running later this month with any luck. No pressure, Jamie. And so what I want to talk about today is how we can invest in Louisiana and make the most of the opportunities that we have. And before I talk about Louisiana, I want to talk about what happened in Minnesota in 2023. I follow a lot of state legislatures around the country. It's a good place to get ideas about what's happening. And in Minnesota in 2023, they had a remarkably successful legislative session. I'm just going to roll off some of the things that happened there in a 4-month span. They created a paid family and medical leave program financed by a payroll tax that will affect virtually every worker in the state. They passed paid sick leave for just about all employees. They created a child tax credit of $1,750 per child at the state level in Minnesota. They expanded their earned income tax credit to be 34% of the federal credit, Keep in mind, here in Louisiana, we have an EITC, but it's 5% of the federal credit. So in Minnesota, it's 7 times more generous. They put aside $1 billion for affordable housing. They restored voting rights to returning citizens. And Minnesota, when you look at all these lists where Louisiana is in the bottom 5, is generally in the top 5. So, I'm not going to say, I know correlation is not causation, but if you look to the north and you look at the states that are really doing right by their citizens, a lot of that comes from their willingness to invest in their citizens. So let's talk a little bit about Louisiana and kind of where we are. And I kind of want to make 3 broad points about the state budget. One, contrary to, I think, common perception out there, state government is not too big. The Legislative Fiscal Office did a great study a few years ago where they looked at the size of Louisiana state government as compared to the size of the overall economy. And he did that for Louisiana and for all the other states. And our government here, state government in Louisiana, is a little smaller than most when you measure it against the size of overall government. So we don't have a big state government. I know people want to kind of convince you but that's not true. State government, of course, is financed by the taxes that we pay. And as we learned from a study that came out just last month, a couple of weeks ago, our tax structure in Louisiana is what we call upside down. It's a regressive tax structure where when you look at the percentage of income that people pay of their income that goes to pay state and local taxes in Louisiana, if you're in the bottom 20% of earners in Louisiana, 13.1% of what you make goes to pay your state and local taxes, primarily sales taxes, which are extremely high in Louisiana. If you're lucky enough to be in the top 1% of earners, then your overall state and local tax rate is 6.5%. So obviously the person in the top 1% who may be making $1 million or more per year is paying more taxes than the person at the bottom, but as a percentage of their overall income, the tax rate for the top 1% is half of what it is for those in the bottom 1%, bottom 20%. And the folks in the next 20% and in the middle class are all paying much higher rates than the folks at the very top. And then the third thing, and I think the thing that we're going to hear a lot about in the news over the next coming year, is that the fiscal honeymoon that we've had in Louisiana since 2018 is going to come to an end very soon. The state government, as I think all of you know, unlike Washington, has to balance its budget every single year. If you want to spend $1 to educate a child, to provide health care, to provide social services, to provide any of the things that we ask state government to do, you have to be willing to raise that dollar through taxes. That's very different from Washington, where a deal often looks like, we'll spend something on your priority and something on your priority, and we'll put it on the tab. It doesn't work like that in Baton Rouge or in any other state capital. But as you know, in Louisiana, the last governor we had came in with a $2 billion shortfall, thanks to some of the work that had happened in the early part of the last decade. We fixed that. We fixed it in an imperfect way by raising sales taxes, then renewing half of that sales tax. But that is going to expire along with some other tax changes next year. So we don't know what the governor's executive budget is going to look like. The governor is expected to present his executive budget on Thursday, so I may be here a couple of weeks too soon because I have no insight into what he's going to propose. But I expect the budget we'll see presented on Thursday for the 2024-25 fiscal year is not going to be terribly severe. There's a $66 million shortfall, according to the Division of Administration, in the context of a $12 billion general fund. That's not terribly difficult to overcome, and we should be able to see a budget that's balanced without any severe cuts. But next year, when that clean penny expires and some other tax changes take effect, we are looking at a shortfall of right now, and this is going to change, but $559 million, and it's going to get worse from there. So by the 2027-28 fiscal year, we're looking at a shortfall of $733 million. And again, that's if no policy changes happen on tax policy and no cuts happen. So in order to fix that budget shortfall, you can do it one of two ways. You can cut spending, or you can raise revenue. And so the math is going to get a little difficult for this governor, not this week, but a year from now. We're going to be having a very difficult conversation about the budget. But we have a new governor. We don't know exactly what he is going to propose because I think he didn't provide a lot of specifics during his campaign. But we know there's a lot of political pressure on him to do a lot of things that could potentially make this worse. We've heard talk about repealing or phasing out the state personal income tax. That came out as one of the recommendations of his transition task force. We know there's going to be pressure to get rid of the corporate franchise tax, reduce the severance tax. So even though we have about over a $500 million shortfall looking at us next year, there's going to be pressure to cut taxes, which of course would make that gap even wider. And I want to talk just for a minute about the income tax. The state's income tax, when you compare it to the other 40 states that have a personal income tax, is one of the lowest around. And it is not terribly progressive. Even though it has a progressive rate structure, we've capped that income tax. But together, the corporate and individual income tax brings in about $5.5 billion every year. And keep in mind, in our state budget, the amount of discretionary general fund in the state budget is less than $3.5 billion. So when you talk about what the legislature actually has control over in building the budget, it's $3.5 billion, which is less than what we bring in individual and corporate income taxes every year. So when you talk about phasing out the personal income tax, what you're really saying is, if we get rid of this tax, we have to replace it by some other source of revenue. If any of you remember what happened when Bobby Jindal tried this in 2013, he claimed that he was going to get rid of the personal income tax and do it in a so-called revenue-neutral fashion. So we're going to raise the same amount of money just by different ends. If that's the route that this governor decides to go, when you do that, what you're really saying is somebody's going to pay more and somebody's going to pay less. And we have not seen anything like that, but we know that when this was tried in 2013, the answer was that we were going to push the tax burden even further down to those groups, the low and moderate income taxpayers and the small businesses who already are paying higher rates than those at the very top. So we don't know what tax reform is going to look like. We don't know if this governor is going to actually go through with those recommendations, but pay very close attention to tax reform and especially the personal income tax, because the devil's going to be in the details and somebody is going to be paying more, and I guarantee you we're going to hear a lot from those who are paying more. And then there's going to be pressure, so there's tax cut pressure. There's going to be pressure to reduce the amount of revenue available to state government, even though we have tax cuts kind of already set to take effect next year. And then there's going to be pressure on the spending side. Doctors and hospitals are already pushing to increase their Medicaid rates. We know that there's a lot of feeling out there that they are not getting that they need higher rates to provide the services they are. We know that teacher pay is still far too low, and school districts around the state are having trouble recruiting and retaining highly qualified teachers. That costs a lot of money. Early childhood education. This is something that has seen new investments in recent years, but if you go by the studies that are out there, we aren't investing nearly enough to make sure that every child 0 to 3 has access to high quality, early learning environments. The price tag on that, if we wanted to make that available to everybody who needs it with low incomes, is over $1 billion. So we're not even close to meeting that demand. We know that child welfare services in Louisiana are extremely underfunded. The Department of Children and Family Services can't find enough caseworkers to do the important work of taking care of the most vulnerable children who are facing abuse and neglect. The juvenile justice system, another area where we need more investment, not less, because we were warehousing children in Angola as recently as last summer, and we still have not figured out a way to make sure that children, and we are talking about children, have the resources they need to get back on the right path. And then on education, one area I think we're going to see a lot of discussion about in this upcoming legislative session is an attempt to implement what are called education savings accounts. This is a debate that came up under the last administration, and one of the dangers of that, and this has been tried, and this debate has been happening around the country in different states. One of the models for ESAs, particularly in Arizona, what they started doing was not just offering choice to families in public schools, but started to underwrite private school tuition for families that are already in private school. So, and if you start doing that, then you're not shifting resources from public schools to private schools. You're adding a whole new cost onto the education tab of the state. In Arizona, that tab came to about $700 million. Louisiana has a lot of kids in private school already, and if we're going to start underwriting that tuition for everybody, then you're looking at another fiscal note, and then you're looking at an even bigger gulf between the tax money we have coming in and the expenses on the state. So if you're the governor right now, and you know this will come as a surprise to many of you, but he doesn't ask me for advice. But you've got a lot of pressure. You got pressure to cut taxes. You have pressure to spend money and make new investments, and you have this constitutional guarantee of a requirement of a balanced budget. And so, you know, we're going to learn a lot about this governor in the next few months that we frankly didn't learn in the campaign, because, you know, I've now seen a few campaigns around the state, and you know, I want to congratulate the governor for running a good campaign because he obviously got elected on the first ballot. But he was able to win election without offering an enormous amount of detail about what he actually wanted to do when elected. It was a very biographical race. It almost made me miss all those 10-point plans that Bobby Jindal used to put out when he ran for office, because we don't really know what he is going to do, but we know that he has some very difficult choices very soon. So what are we asking at the Budget Project? Well, the first thing is, you know, we need to either renew that clean penny that's expiring, or even better, replace that revenue with some other revenue source. But that's about $400 million in tax revenue we're collecting now that we're not going to be collecting starting July 1 of 2025. So we need to find a way to replace that revenue. We need to find a way to replace revenue from the vehicle sales tax that has been diverted to the Transportation Trust Fund. And we need to kind of think about what it really means to invest in Louisiana. This past year, we worked very hard on paid leave. I think paid family and medical leave is something everybody who works should be entitled to. The governor, as one of his the last governor, as one of his last moves, extended that to state employees, both classified and unclassified, through the state civil service and through an executive order. We're going to be trying to build on that and hopefully extend that to K-12 teachers and school support personnel. And ultimately, I think the goal is to make sure everybody who works has access to paid leave away from their work if they need to take care of themselves or a sick family member. This is something people in most countries and many states, a growing number of states, take for granted. but we don't have that here. We are certainly going to keep talking about establishing a minimum wage in Louisiana. That's one of the simplest things we can do to really lift living standards and provide, make sure that work is valued. The fact that we are still stuck at $7.25 in this state is just an abomination. We're going to be closely watching the crime special session coming up. Certainly, we wish them well, but we want to talk about, how we can build on some of the success, frankly, we've had in making Louisiana less incarcerated, and hopefully look for some policies that actually lead to rehabilitation and people re-entering society with some skills and some supports that they need. And ultimately, we're going to be closely watching the debate over property insurance. I think that is something that is affecting a lot of people, particularly in South Louisiana. And so I think one of the key things, and I think there's going to be some real interesting debates there, one of the key things we can do is make sure, in order to lower the cost of property insurance, we have to make homes more resilient. There was a fortified roof program that they put $30 million towards it this year. I think that program was subscribed in something like 5 or 6 minutes. It went faster than Taylor Swift tickets. But we need to make sure that there's an ongoing source of revenue available to help people fortify their roofs, because if the roof stays on your house, the chances of you having an expensive claim after a storm goes way down, and so does the cost of property insurance. But we want to make sure they also keep some of the important consumer protections in this state in place, and don't use this insurance crisis as an excuse to take those things away. And hopefully, I think when we start talking about this budget shortfall, there's been talk about having a constitutional convention. I'm a little skeptical about that, but I also am aware that there are some constitutional things in place that make it very difficult to raise revenue in a flexible way. And some of those things are like the 2/3 requirement in Louisiana to raise $1 of revenue when it only takes a majority vote to pass a budget that cuts money from vital programs. We have a constitutional cap on personal income tax rates, so if a legislature decided we actually wanted to ask people above a certain income to pay a higher rate, we couldn't do that because it's capped at 4.75%. And we have this interesting new phenomenon of a new rainy day fund that was created a few years ago that says any dollar over $600 million in corporate income and franchise taxes goes into this new rainy day fund. So even though there are some very important reforms that we could make to the way we tax corporations in Louisiana, even if we did that, that revenue wouldn't go to the general fund to help us pay teachers or fix some of these problems. It would go, it would roll over into the new rainy day fund. So the good news is we have $3-point-something billion in reserve, whereas those reserves were extremely low a few years ago. But there may be an argument for looking at some other ways and giving the state a little bit more flexibility with that money, because again, memories are short in Louisiana. I was thinking about, and I don't have an exact number of how many legislators now have been through a cycle where the budget was getting cut every year in December through mid-year cuts every year in the spring. But unless you are somebody who switched chambers, then right now, if you're in your third term, it meant you came in, you came in with John Bell, right? Yeah. So even the third, yes. So most, there is nobody except for, a few Francis Thompsons out there who lived through that period where every year the budget was getting cut. Every year we were asking students at LSU to pay more and get less. Every year we were, facing restrictions on Medicaid, selling state property to make ends meet. Those memories aren't there for a lot of these folks, but math is real, and the math on this budget isn't mathing starting in about a year. So, and frankly, if we want to have the kind of outcomes that Minnesota has had, then we need to be talking about how to make the right investments. And so that's what I've got, and I'd be happy to answer any questions that you may have, or do my best.
I got a couple. On the paid medical leave, Governor Landry didn't try to undo that?
Not yet.
Under the federal money for green energy infrastructure and those deals, there's a lot of provisions for community benefits. Do you see they'll make any difference, and will y'all be monitoring?
The question was about all the federal money coming in, and the answer is yes. I think this is a historic opportunity to invest in Louisiana communities. Some of that comes to Louisiana via a formula, and I don't hold myself out as an expert on IRA, but we certainly intend to become much more knowledgeable. But I know that a lot of this money is awarded on a competitive basis. And I think our concern, and where we are really going to be trying to put some effort into, is making sure that the communities where these investments are needed the most have the opportunity and the wherewithal to compete for that funding. And so we hope that there's outreach, and we hope that there's technical assistance, and we hope that, yeah, absolutely, and that this money, goes to create the good jobs that are needed. I mean, so that is something we're watching carefully, and I think it's an incredible opportunity for Louisiana. But we need to make sure we do it right.
Could you enumerate the differences between your organization and public affairs research or FAR?
Well, we are entirely separate organizations. Governed by separate boards, funded by different funders. I can't speak exactly to PAR's funding structure. We're both nonpartisan, but we don't hide that we do research and advocacy through a specific lens, and that is that we think public policy at the state level should work to lift up low and moderate income families. And so we do, and again, that's a nonpartisan stance, but we have a particular point of view. We don't shy away from that. And I admire and respect the work that PAR does. I think they are the gold standard when it comes to talking about things like access to open records. I mean, they do a lot of great research. I have nothing but respect for my friends over there, but we play different roles. Yes, sir.
You made mention in passing of where Louisiana ranks in so many different criteria. I assume some of that is the relationship there between revenue and causation and the outcomes that we receive. What would you say is the fundamental problem that has led to that?
The question was about our rankings, and I think we've all heard in Louisiana, it's almost a cliche, we're at the bottom of the good list and at the top of the bad lists. To me, those things all correlate with poverty. Crime correlates with poverty, health correlates with poverty, educational attainment correlates with poverty, and so our focus really is on reducing poverty, making sure that, and we're not talking about, we're really talking about making sure families have the tools that they need to be successful. And if you don't know where your next meal is coming from, or if you're going to be able to pay the rent, if you're working 3 or 4 different jobs in order to provide for your kids and you have no time, you're not going to be the best possible parent. and you're not going to give your kids the start in life that they deserve. So what we're really talking about is if we can do a little bit more to alleviate material hardship and put people, give people some basic stability and a safety net for when they lose their job or if they're going through hard times, then we can move the needle on all these other things. We talk a lot about investing in healthcare, but most of the things that go into good health happen outside the healthcare setting and outside the doctor's office. It has so much to do with what we eat and the air we breathe and the exercise we get and all these things, and it frankly correlates with stress. So there's been a lot of research recently on toxic stress, and that correlates with poverty. So I think if we can start moving the needle on poverty, we have the second highest poverty rate in the country in Louisiana. We have the third highest child poverty rate in Louisiana. We're in a state where almost 50% of African American children are growing up below the federal poverty line. If we don't move the needle on poverty, then we're going to stay 48th, 49th, and 50th on the lists where you want to be first, second, and third, and vice versa. Yes, sir.
Can you tell us a little more about your organization's objections to the Blue Cross Foundation proposal becoming a C4 rather than a C3?
Sure. The question was about Blue Cross, Blue Shields, and I think, and that hearing is going on as we speak. I was watching it online before I drove over here, so there may be some new developments that I'm not aware of. Our concern was with the structure of the foundation that would be created as a result. I mean, I have some secondary concerns about whether, having an out-of-state for-profit corporation take over the health insurer is going to affect rates and costs. I mean, they don't get in this, they're in this to make a profit. But if this sale goes through, there's going to be a lot of money that goes to create a new foundation. And our initial concern was that this foundation was structured as a C4, which is a section of the tax code where that's more political, essentially. And our concern was certainly that if you're going to do this, you should structure it as a 501c3 nonprofit, because we would want to see it certainly be used to benefit, not as a lobbying arm of the health insurance industry, but as something that is genuinely focused on promoting public health in every corner of Louisiana. So I think this foundation, if the sale goes through, this foundation presents an incredible opportunity. We don't have any $3 billion foundations in Louisiana that I'm aware of. We might, but I think this would be a landmark event for public health, but it needs to be structured in a way that the money truly goes to benefit the communities that need it. Yes?
So in your budget on Thursday, along with the executive budget, they're also doing the expenditure limit calculation. I'm guessing that's not going to be a big deal going forward. Could you just talk a little bit, just sort of explain what the expenditure limit is, why it matters, and does it have anything to do, or is it going to have any bearing on the budget?
So the question was about the expenditure limit. The spending limit was put into the Constitution in the 1990s. Marcia could probably tell me. It was before I got here, and it is, and it's. I couldn't tell you exactly the formula. I've known this off by heart, but I hadn't thought about it in the last few months. But the way it essentially is supposed to tie the growth of state expenditures every year to the size of the economy plus inflation. And over the years, it has tended not to be a factor. The only times we've bumped up against the spending limit was in those years immediately following Hurricane Katrina, when the economy was and the state budget was growing like gangbusters, and then we bumped up against it I think during the pandemic years when we had a lot of federal aid coming in that kind of goosed the economy and goosed revenues. There have been attempts over the years to make that cap more restrictive, which we have spoken out against. I think, we have a spending limit already. It's called 53 votes in the House and 20 votes in the Senate. There's nothing that says they have to spend every dollar that's available to them, but I don't think that's the job of the Constitution. If it were up to me, we wouldn't have that in the Constitution at all. And certainly, because I think we have, again, we have a balanced budget mechanism. They can't spend any more than they take in, and if they want to spend less, then the people's representatives have a chance to do that every single spring. Yes, sir.
Can you talk about Medicaid Unwind and how that process is going and how that impacts the state budget?
Well, so the question was about the Medicaid Unwind, and as many of you probably know, was during the pandemic, Louisiana and every other state got more money, higher percentage match from the federal government for Medicaid, and in exchange for accepting this extra money, they couldn't kick anybody off the Medicaid rolls while the public health emergency was in effect. So during the pandemic and after the pandemic, Louisiana's Medicaid rolls grew because people cycle on and off the program because sometimes you make, your income is low enough to qualify, but if your income goes above a certain level, maybe you change jobs or something happens, you no longer qualify. Well, nobody was losing Medicaid coverage for a good 2 years until last spring when the public health emergency ended and the state started reviewing eligibility. I want to say that the Department of Health was extremely proactive in reaching out and trying to get the word out to as many people as possible. If you've driven around Baton Rouge, you've seen the billboards. They've done their very best to communicate with Medicaid beneficiaries, but we knew going in that it wasn't going to be perfect and that they weren't going to reach everybody. So I forget the latest numbers, but I think it's about 350,000 people have been kicked off the rolls. But we know that most of those are for procedural reasons. Most of them weren't kicked off because they make too much money, but because they didn't answer the letter. People's, you get how many of us get mail that we think is junk mail, but might have been critically important? So, and we know a lot of them are being re-enrolled sometimes when they show up at the hospital, maybe not knowing that they had lost their coverage. As far as the state budget, I think you're not going to see the savings that people expect from shrinking the Medicaid rolls because of the way we structured Medicaid expansion. As you know, the state is only responsible for 10% of the cost of the Medicaid population, and the state finances that through a couple of ways. There's an insurance premium tax that is charged, and there's also the hospital provider fee that is charged. So, in other words, we have dedicated sources of revenue that pays for the Medicaid population, so we're not talking about taking a dollar out of that discretionary general fund. And frankly, I think getting $9 from the feds for every dollar that you put up as a state is one of the best returns on investment. If we only got that kind of return on investment on film credits, we'd be in a better financial shape as a state. So Medicaid is a good deal for the state. It's a great deal for hospitals, nursing homes, clinics, other providers. All you have to do is drive around Baton Rouge and see all the health clinics in places where they didn't exist a decade ago to see the impact that Medicaid expansion has had. For as long as, for the first 10, 15 years in Baton Rouge, all I heard about on health care was how we needed to have more community health care closer to where people lived. We have a lot of that now, and it's because we made a lot more people eligible for health care who can now go to any doctor or clinic that accepts that coverage, and it's, again, very cost-effective for the state. So the reason we have a budget problem coming up is not because of Medicaid expansion. It's because of expiring revenue. Yes, ma'am.
So you talked a little bit about the property insurance problem and the organizations that are helping with roof repairs to help bring down that cost a little bit. Can you expand on that a little bit? Like how many families is that really helping?
I don't know. The question was about property insurance and fortified roofs. I think they put aside $30 million, and I think that was out of either surplus or excess revenue, but it was a one-time appropriation. And again, I think it went extremely fast. And so not nearly everybody who applied or wanted to get help to pay for a fortified roof, because if you're a low-income family, even if you're a middle or high-income family, replacing your roof or fortifying your roof is a pretty expensive undertaking. And you're not going to see the savings right away. Whatever you spend up front is, you might get a reduction in your property insurance, but it's not going to be dollar for dollar. So I don't have a clear picture of the demand, but I do know that there have been conversations about how do you set up a recurring source of revenue so that there's money coming in every year and that's available, and then you have to set up a process for who gets that money, and how do you apply, and how do you make sure it gets to the areas where it's needed most. And again, I'm not going to hold myself out as an expert on this, but I think it's going to be a really interesting conversation. And out of all the things that I've heard that could kind of, we're not going to fix climate change in the 2024 state legislative session. And climate change doesn't know, state borders. But insurance is a state market, and I think the most important thing we can do is make homes more resilient so that the next hurricane that blows through, if your roof stays on your house, you're going to have a much, much easier time recovering and a much less costly recovery than if your roof goes. So I think that's going to be a critical debate. I'm not sure where it's going to go, but I think I know, Commissioner Temple, I hope he shows up here. I think he has some ideas, and I know that it's something that is attracting attention on both sides of the political aisle. John.
I have a question. I hate to ask you this, but I'm just busy back here. Can you very quickly reiterate what Minnesota did, what the advantages are, maybe how much it costs?
Sure. I don't have an exact, I don't have a copy of Minnesota. The question was about Minnesota, but in their legislative session last year, they created a paid family and medical leave program. They created a paid sick leave program. They created a child tax credit of $1,750 per child. They increased the earned income tax credit to 34% of the federal credit. They put aside $1 billion for affordable housing. They restored voting rights to returning citizens. There was a lot more. Those were kind of the headlines that I picked for this. Yes, sir.
In a nutshell, it seems that Louisiana is in a poverty level very hard to get out of. Can you comment?
The question is, Louisiana is in a poverty level that's very hard to get out of. Yes, it took us 300 years of history to get to where we are, and there's no silver bullet answer that is going to fix it, next year or the year after that. But we can start making some down payments and some investments that can pay immediate dividends. I want to remind you that in 2021, when the federal government expanded the federal child tax credit, they did three things to the child tax credit. They increased it from $2,000 to $3,600 per child. They made it fully refundable so that no matter how low your income was, you were eligible for the full amount. And then the third thing they did was they paid it out in monthly installments, so that instead of getting it one time when you pay your income taxes, they got monthly allowances. And that one policy intervention cut child poverty in the United States in half in 2021. That's never happened before in American history. One policy intervention is responsible for a dramatic decrease in child poverty. But that expanded child tax credit expired on January 1st, 2022. They fell 2 votes shy in the Senate of renewing it. Kirsten Sinema and Joe Manchin. And so child poverty in 2022 went right back up. It's the clearest case there is of a policy intervention working and going away. And, you know, cutting child poverty in half for 6 months is nice, but it's not the long-term answer, because children are children for 18 years. And so you need to make these investments, you need to make them over a long period of time, and you need to make sure, you know, healthcare is accessible, that education is accessible and affordable, and that children have the basic needs taken care of. And so if you do those things and you do it over a sustained period of time, and you invest in things like early childhood education, then I think you can move the needle. But again, it took us 300 years to get here, so it's not something that you fix in a year, but I do believe I wouldn't do this work if I didn't think it was possible to lift more families out of poverty and into the middle class. Other states have done it. Louisiana can do it, but it takes policy change.
Thank you very much.
Thank you.
Our speaker next week is Daniel S. Famer, who is head of the Pelican Institute. And on February 26th, as John suggested, the speaker will be Tim Temple, the insurance commissioner.